Nursing 345, the complete health history. The objectives for this week include understand the use of diagnostic reasoning and clinical judgment, discuss the importance of high-level assessment skills, describe expected physical, psychosocial, cognitive, and behavioral milestones of a patient on the basis of developmental stage, assess the basic characteristics of culture and the steps to cultural competence, define the meaning of the common nonverbal modes of communication, and lastly, assess the behaviors that are considered in an assessment of a person's mental status. The health history, there's a sequence. We would start with the biographical data, which includes name, address and phone number, age and birth date, birthplace, sex, marital status, race, ethnic origin, and occupational, usual and present. The source of the history, that is who you need to record who furnishes the information. It's usually the person, although source may be a relative or friend. Judge the reliability of the informant and how willing he or she is to communicate. A reliable person always gives same answers when questions are rephrased or are repeated later in an interview. Note any special circumstances, such as use of an interpreter. You need to find out the reason for seeking care. This is a brief, spontaneous statement in person's own words describing reason for a visit. A symptom is a subjective sensation a person feels from a disorder. What the person says is the reason for seeking care is recorded and enclosed in quotation marks to indicate person's exact words. A sign is an objective abnormality that can be detected on physical examination or in laboratory reports. Present health or history of present illness should include location, character or quality, quantity or severity, timing, setting, aggravating or relieving factors, associated factors, and patient's perception. Past health should include childhood illnesses, accidents or injuries, serious or chronic illnesses, past hospitalizations, operations, obstetric history, immunizations, the last time the person had a physical exam, allergies, and current medications. Family history would include age and health or cause of death of relatives, health of close family members, family history of various conditions such as heart disease, high blood pressure, stroke, diabetes, blood disorders, cancer, sickle cell anemia, arthritis, allergies, obesity, alcoholism, mental illness, seizure disorder, kidney disease, and tuberculosis. A family tree, which is a genogram, should be used to show this information clearly and concisely. There's actually the next slide, I will show you the diagram of a genogram. A functional assessment should include activities of daily living. Also, you would want to assess self-esteem, self-concept, activity and exercise, sleep and rest, nutrition and elimination, interpersonal relationships and resources, spiritual resources, coping and stress management, personal habits, illicit or street drug use, environment and work hazards, and intimate partner violence, and lastly, occupational health. There is also, you should do a review of systems, which on the slide after the genogram, you will see the review of systems. So here is the genogram, our family tree, and you would create this so that you would have a concise and clear tool that can provide information as far as family history. This slide is review of systems. So if you just take a look at that, it's actually every system and what you would include in your review of systems. A cage test. This is for people that have a history of drinking, or you can help them to determine if they do have a problem with drinking. The questions include, have you ever thought you should cut down on your drinking? Have you ever been annoyed by criticism of your drinking? Have you ever felt guilty about your drinking? Or do you drink in the morning for an eye opener? Perception of health. You can ask the following questions like, how do you define health? How do you view your situation now? What are your concerns? What do you think will happen in the future? What are your health goals? And what do you expect from us as nurses, physicians, or other healthcare providers? There's also special considerations regarding the older adult. You need a medication profile, which would include current medications. You also need to consider that some older persons take a large number of drugs prescribed by different physicians. I believe this is decreasing with the use of electronic health records. The person may not know drug name or the purpose of their drugs that they are taking. Ask a person to bring in the drug to be identified. When and sometimes for older adults, when the person is unable to afford a drug, he or she may decrease dosage or not refill immediately, or they may take it every other day to save money. You have to remember that for older adults, just traveling to the pharmacy may present a problem. And they also may use over-the-counter medications for self-treatments. And they may also share some of their medications with families, neighbors, or friends.